Hi everyone, our topic this week is the role of qualitative research in theory development. I've assigned 3 articles, but note that they are all optional because this being the last week of the semester, there are no new assignments related to your readings. So you can read them kind of on your own time. So the objective of this short lecture is to explain the contributions of qualitative research to the process of theory development and the significance of theory development to occupational therapy. So when we're talking about a theory is a plausible or scientifically acceptable general principle or body of principles offered to explain a phenomenon. Now, we talked earlier in the semester about how important it is to have a theoretical framework for a qualitative research study, but it's also quite important to practice as well. It's relevant for the development of all scientific domains. And sometimes we think of theories as being macro, like the theory of gravity, for example, but they can also be quote unquote micro and really specific to certain situations. And really, we use theories all the time in the process of clinical reasoning, just we don't always note that we are. For example, sometimes we prescribe exercise to improve ham strength. And in making that clinical decision, we're drawing on theory that there is a relationship between strength and function, that these exercises will result in an improvement in strength, and that this particular patient is capable of increasing their strength, and that the problem the patient is experiencing is caused by muscle weakness, and that these exercises will remediate that. So that's just a small example of how we sort of use theory all the time and often just don't really think about it. So when we're talking about connecting research and theory, we note that empirical material is never objective, and this is something we kind of have to adjust our brains to thinking about, because we often think of quantitative research as being objective, but there's always some subjectivity based on researcher biases, the type of language used to describe the problem, what methods are used to evaluate a research question. And sometimes what we learn from research can cause us to revisit existing theories and question if they have room for change or growth or modification. According to Alvison and Karaman, theory development is stimulated and facilitated through a selective interest in what does not work in an existing theory, in the sense of encouraging interpretations that will allow a productive and non-commonsensical understanding of an ambiguous social reality. So really, that's kind of just restating in a different way that we take what we learn, and if it doesn't fit with our existing theory, we have to go back and change it or come up with a new theory. And often that's not, it goes beyond the surface explanation. And they also note that data and theory are not separate entities, right? Because if empirical material is never objective, there's always some theoretical perspective behind it. So how does theory emerge from research? Again, theory generation occurs in dialogue with empirical material. It happens when there's a breakdown between what we think we know or how the theory works and what the data show us. We look at other literature and different ideas in whatever realm we're studying, and kind of the social nature of the research itself in the context of the profession and the cultural context. And this quote from Kuhn, and this is one of my favorite texts to refer back to, The Structure of Scientific Revolutions. He talks about knowledge emerges only for the man who, knowing with precision what he should expect, is able to recognize that something has gone wrong. So it's the anomaly that appear, you only can spot the anomaly when you have an expectation of what's supposed to happen, which in the context of the existing paradigm. And that's really what we're talking about here when the data challenge what we think we know about how things work. So I'm going to share 3 examples of theory emerging from qualitative research, and these correspond to the articles that I've listed as the readings for this week. One looking at a macro level, one looking at a middle level, and one at a micro level. So Iwama and colleagues came up with the Kawa model, which was an alternative framework for occupational therapy practice. You may have heard of this or be familiar with it, as it's often taught in curricula. And this emerged, the Kawa model emerged from research in Japanese culture, and they found that the Western models were really not representative of their values and how they and basically their worldview. And the thing with our theories and frameworks, they don't have to be universal. We do want to have cultural sensitivity and context. And if the theory doesn't match that cultural context, it's not going to be very effective for practice or research. And the Kawa model, this is the graphic that they use to explain it, but they look at the life flow and health as the water. There's personal assets and liabilities, which they characterize with the driftwood, the life circumstances and problems, which are visualized with rocks, and then the environmental factors, so that's the river walls and the floor. So it's kind of the flow of life sort of perspective. And if you're interested in learning more about the Kawa model, I suggest you read that article. From the meso perspective of theory development, Clark and colleagues wrote a synthesis of habit theory. They drew from many existing theories of habit, but this was really driven by qualitative findings from a study that evaluated the development of pressure ulcers in adults with spinal cord injury. So they identified different practices, related to skin health and pressure management for these adults with spinal cord injury, but looked at different levels of habits. So things from a tic up to habitus. So kind of a full range of levels of habit. And they drew from multiple existing theories, not just a single one, but they and put it all together in sort of a continuum. It's a different approach than Iwama in the Kawa model, because the Kawa model was kind of a new theory generated from the research. In this context, in the synthesis of habit theory, it was drawing from multiple existing theories and perspectives to kind of organize and understand the whole continuum of habits. Then on a more micro scale, Solomon and Lawler identified wandering and elopement in autism. In this case, it was very specific to a particular condition and situation. And this research kind of uncovered or challenged some existing views about what this phenomenon was. And the way they did that was they used the parents' perspective to supplement what was already known about this particular behavior of children sort of wandering off, children with autism wandering off. And they identified really a gap in care, that this is not something that's typically addressed in treatment. And they sort of reframed just how this problem manifests as a family problem and not necessarily exclusively a clinical problem. And also they talk about, in the particular context of African American children with autism in an urban environment, that it's a potentially life-threatening problem as they become older. So again, if you're interested in learning more about these different perspectives or specific theories, I would encourage you to read these articles. But basically, to summarize, I want to reiterate, theory is implicit in everyday practice and certainly in all research, and should often be explicit in qualitative research especially. Um, and theory development happens from qualitative research when the findings don't match the expectations. And at last, that we can have multiple levels of and layers of theory. It doesn't have to be universal. It should be context specific and situated, and it can and you can have multiple theories and layers coexisting at the same time. Here are my references from this week. I hope this lecture was helpful.